My next speaker is Dr. Susan Tan, who is the consultant child and adolescent psychiatrist who has extensive experience in public and private practice. Dr. Susan Tan's topic today is developing pandemic mental health resilience, our best strategy to weather the COVID storm. The floor is yours, Doctor.
Thank you, Mr. Keith Tong, for inviting me to be a guest speaker at this illustrious conference. I am honored to be amongst the shakers and movers of the digital age and educators as well, both from Malaysia as well as internationally. My name is Dr. Susan Tan. I'm a child and adolescent psychiatrist, and I would like to highlight the mental health challenges facing our children, especially school children, in this time of the COVID pandemic, and most importantly, what we can do. Thank you. My topic today on mental health challenges of children, schools, and the COVID pandemic is basically to ask ourselves, after 16 months of enduring this difficult time, what have we done and what can we do to make a difference? Yes, ladies and gentlemen, we need to look at mental health challenges of school children, schools, and the COVID pandemic, and what we are doing to be able to make a difference after enduring this for the last 16 months. COVID pandemic has been the first global challenge that has brought the whole world to its knees for the last 16 months. Starting in Wuhan, China in December 2019, it was declared a pandemic by WHO in March 2020, when governments all over the world implemented a lockdown. In Malaysia too, we had our 3 lockdowns starting from the 18th of March, and now we are on to our 3rd lockdown, where all schools were closed, all borders were closed, and non-essential businesses were closed. We also had to declare a state of emergency on the 12th of January, and schools still remain closed now, hopefully until the 28th of June, when it will be reviewed. What about other countries? In neighboring Singapore, they managed to contain the virus, but a sharp spike in cases caused schools to be closed, and all businesses, non-essential businesses as well, from April 3rd to May 2021. In Thailand too, there was a state of emergency. Schools are still closed to July. Philippines, likewise, a state of calamity for 6 months. Vietnam had been able to contain the pandemic well. Indonesia also has a public health emergency, likewise Cambodia, both of which are declared on March the 31st, and Brunei schools remain closed until May 14. So schools have been closed for a minimum of 1.5 months and a maximum of 7.2 months over this whole 16 months in all these different countries. In Malaysia, Thailand, and Vietnam, is almost for 4 months. So what impact does that have on our children? UNICEF actually started this rapid research response agenda, looking at child well-being, how schools have impacted the well-being of children, basing their data on epidemiological studies, looking at mental health and social impacts. They also looked at children online and how students and children were coping with studying online, and also the dangers that have crept in. Predators have crept in quietly and are now exploiting our children. They also looked at gender problems, gender bias complications. They looked at social protection, as well as education and how schools can prepare to reopen, as well as child protection. So what has the pandemic caused our children to suffer? There's anxiety, stress, disruptions in their daily lives, school closures, loss of contact with beloved teachers, friends, sports, lack of social gatherings, increased social isolation, therefore, and thus leading to boredom, lack of motivation, frustration, clinginess, irritability, fearing to ask questions about the pandemic. And these are serious challenges to our mental health, both of our children as well as of ourselves. Patients who are children who had to be confined in Italy and Spain also experienced negative emotions, mainly associated with anxiety, feelings of loneliness, irritability, problems with concentration. In countries near to us, such as Philippines, China, Vietnam, and Thailand, the majority of children who experience negative anxiety, anxious emotions were mainly girls. 30% of girls in the Philippines, 30% of girls in China, 60% of girls in Vietnam, and 75% of girls in Thailand experience things like stress, boredom, frustration. 30% also felt sad in Philippines, in China as well, 50%. And these are all the negative emotions that our children have been going through. Here we see as well clinginess, irritability, all the way from age 3 to 18. In the UK, the younger children tended to feel more fear and anxiety, especially related to COVID. Amongst adolescents, what were the problems? Loneliness would be one of the things, bearing in mind that this is an age when peer pressure and peer group are very important for this developmental stage, thus resulting in losing links to other people and feeling excluded, resulting in depressive symptoms. Children or adolescents with social anxiety felt even more lonely, and this was perceived by a threat to social relationships. Sadly, online school was also associated with predators creeping in because children had lots of time on their hands. They were not allowed to go out, and their parents were busy working online from home. So children had exposure to unstructured time online, exposing them to harmful and violent content as well as cyberbullying. There was also a lack of face-to-face contact with friends and romantic partners, leading to a heightened risk-taking, sending sexualized images. The Philippines Department of Justice reported a fourfold increase in reports of online sexual exploitation and abuse during this 1 year. Vietnam too, UNICEF in Vietnam uncovered an online beauty contest for children aged 12 to 15 who had to submit naked pictures to participate. Thus, children who are naive and innocent were subject to exploitation without them realizing it and without their parents being aware of it too. Here we're talking about violence. Girls were at increased sexual and gender-based violence, early pregnancy and child marriages. Save the Children estimated that 61,000 girls were at risk of early child marriages, 118,000 at risk of adolescent pregnancy across East Asia Pacific. Child marriage being a means of parents getting one child less to feed. Violence against women and girls went up between 25 to 50%. In Vietnam, a shelter called Peace House reported 2 times the usual number of women and girls who sought shelter. In Malaysia, Talian Kasih Helpline reported that violence against children increased by 12%. Reports of domestic violence increased 3 times. In Thailand, the UNICEF-supported Child Line had 9 times increase in calls compared to before. So what difference can you, as an individual, as a parent, as a teacher, as a school head, perhaps a policy maker, on an international fraternity of educators make to this group of children who are our future? Firstly, observe and listen to the child. Put yourself in his shoes. Help him or her calm down and facilitate support and early intervention when needed. So this is what Interagency Standing Committee had done. They had looked at how we could address the mental health and psychosocial aspects of the COVID pandemic, and they say the same. Listen actively to your children with an understanding attitude. Children may be responding in different ways. They may be acting out because they're anxious and withdrawing. If you give them a safe and supportive environment to express these negative emotions, whether it be playing or drawing, you can help all these children express this disturbing feelings of anger, fear, and sadness in a positive way, and it won't come out as negative behavior. And what's very important is that we need to have a sensitive and caring environment around the child, and children take their emotional cues from people who are important in their lives, who are adults, and therefore adults need to maintain calm, listen to their children, and reassure them. Keep regular routines, give them child-friendly information, avoid speculating about information that is unverified in front of them, make things fun, use games and stories and songs to help things which are new, like washing hands, become a new normal. What about teenagers? When teenagers show negative behavior and don't cope well, help them to regulate their emotion by going for a walk, to run, to breathe deeply, draw or paint, and later on help them be able to manage these negative feelings and express them. Find ways for them to keep in touch with friends and family because of the necessity to keep in touch with peers especially. So World Health Organization, UNICEF and UNESCO have come out with what considerations are necessary for schools. What's important is that we want to have schools have a social, emotional learning environment that is positive. We want teachers to look out for children who have dropped out of school for whatever reasons, whether it's poverty, whether it's problems at home, help children and young people have access to mental health and psychosocial support services, be alert to the possibility that these people may have experienced violence or sexual abuse during these times of pandemic restricted mobility, and therefore help them seek support and care. One of these is Monsters Among Us, a youth advocacy non-governmental organization in Malaysia that's helping combat child sexual abuse, especially online child sexual abuse, that is presently available for Malaysian youth. So the COVID-19 pandemic has also disrupted education, and the longer the school closures last, the more negative this will be. So we know that for a fact, girls will be more likely to be out of school, with boys being left in the schools. We know that their grades will be falling, the level of proficiency will go down, and even if there's long distance learning, it does not necessarily mean that it's going on fine. And many schools have closed for at least 5 months. So what do we do to stop this from getting worse? What is our exit from this pandemic? Vaccines. So thank God we have vaccines. The rollout started in January 2021. Malaysia started in February. And we need to reach herd immunity ASAP. Why? Because if we have 60 to 70% of our populations vaccinated all over the world, according to Dr. Swaminathan, who is the WHO's scientist, there will be a good chance that the transmission of this virus will be stopped. So this is Dr. Swaminathan talking about herd immunity. So what's the status of all our countries with regards to herd immunity? Sadly, to reach 60% of at least one person or people having at least one dose of the vaccine, we are not there yet, except for Singapore. All our countries, Malaysia, India, Japan, Indonesia, Thailand, Vietnam, are still between 10, 20th, or at best 30th%. Singapore is the only one between 40 to 50%. So if we reach 60% of our population being vaccinated, we have a good chance that we will be able to manage the virus, open schools again. So what's the most important thing having children go back? This is a young boy who has forgotten where his classroom is when he went back to school. And even though the teacher was in front of him, couldn't recognize him. He was so distressed, but look at him today. He was treated kindly. So this is the most important thing we need to learn, that we need to be wary of our children's most important needs, that is mental health needs. When they're distressed, when they're in an anxiety state like this, there is no way the child is going to be able to learn anything. So this is of primary importance. We want to build a pandemic mental health resilience amongst our children. We want to help them see that life can be a half full glass, not always the half empty glass. And this helps with us as parents and as adults who are looking after them. If we'll help them see that they can see your friends, you can see your friends again, but you have new normals like wearing masks, washing hands, doing PE and other things in a different way, and keeping yourself and your friends safe, they will realize that it's not such a bad thing after all, and they will follow this new normal. If they are actually able to understand that these are things that can help protect, and they become therefore superheroes, they will want to do it to protect their friends and their loved ones. So let's, as adults, look at the positives, look at the strength and resourcefulness of our communities, help to create safe, protected environments, look at individual actions and collective actions, promote hope, safety, calm, social connectedness, self and community efficacy, look after the vulnerable like children and people exposed to gender violence, help make available telephone hotlines, look out for loneliness and have strategies to help them maintain structure, quality and quantity of social networks, help children and adolescents feel they are part of a bigger group of superheroes working together to make a difference, like baking a cake, for example, or cookies to help buy groceries and put in the food bank for the poor. Help them find a sense of belonging within the family and that they can be part of the superheroes making a difference as well. Also with digital technology, and this is where our experts in digital technology can come up with solutions, address negative thoughts using digital technology that have worked. Computerized CBT, things like Mood Gym, Sparks, Think, Feel, Do. Also pen and paper, helping children to journal. UNICEF has a good approach towards mental health, and we need to look at how we want to make prevention, because it's much better than cure. And this generation of children living through this first ever pandemic do not need to live without a childhood that's good. So again, addressing mental health needs, look out for red flags. If these are happening amongst the students that you teach or your children, look out and see if they need to have early intervention. This is educational material that was created by 1,700 children from 104 countries when the pandemic started. This is under the IASC, and it has done a fantastic job because it has gone all around the world. 1 year now, from the time this book was launched, it has gone all around the world and met the needs of numerous children, and it has actually been translated to numerous languages and explained COVID to all these frightened, anxious children who are probably throwing tantrums and not knowing what's happening. So you can see on this world map that it has covered 87% of the world, and this is something we can emulate. Here is one child who said, when I had the coronavirus, I had to go into quarantine alone. When I was in quarantine, I imagined Ariel, who's the hero dragon, coming to me, joining me and my mom, my dad, and my sisters. And this is a child from the occupied Palestinian territories. Thank you.